My name is Diego Lima. I'm an orthopedic surgeon specialized in shoulder and elbow and hip pathologies. We see anything from minimal pain to major traumas, patients with pathologies that can be considered chronic issues or acute injuries. Being a physician was always my passion, but I also had a lot of influence from my father, who was an orthopedic surgeon as well. Once I became a physician, there was no question about what subspecialty I would do. So I believe that the care of a patient has to be customized to that patient, tailor-made. Medicine nowadays has evolved to a point that we're able to get to that detailed level of starting with education to the whole treatment. Surgeries nowadays are customized to the patient, so the office-based treatment has to be done accordingly as well. In particular, shoulder arthroplasty and rotator cuff repairs. So the pathology around the shoulder are things that fascinate me. So that's what I spend most time studying and practicing and, obviously getting better every day at it. So I was born and raised in Brazil. Did a big part of my training down there. I went to medical school, residency, and some of my subspecialties that were done in Brazil as well. Then I moved to the United States, spent a few years at Cleveland Clinic, where I finalized my training before I started in practice 4 years ago. Well, when I'm not fixing people's joints, I fix cars. I have a passion with racing, and I run my own racing team, which is me as a team principal, me as a mechanic, and also the driver. So that's my passion. I have currently I have a BMW M Roadster, but my first one was, which is still my favorite, it was an NC Miata. I think the most rewarding aspect is right after a very difficult operation, you see the patient and you know what to expect, but you want to see how well the patient is doing, and surprisingly they're very emotional because you saved their lives, right? So it's in a way you're getting them back to life or to normal life, and that to me trumps it all. I take very proud. I take pride in my work. I take responsibility in what I do. I try to do the best I can. So the commitment I have towards my patients is the primary drive of my job. So whenever I'm committed to take care of a patient, that's going to be 100%. And because of that, I see more and more patients coming back or referring me to other people. So I think that's important, and that's how I like to be treated as a patient. After all, I'm also a patient. And so I try to find physicians that can take care of me the same way that I do with my patients.